So patients often come in and they take the lower eyelid skin and they kind of pinch it and they say, do you see how I have this extra skin here? I just want that gone. And that makes total sense. It's tempting to think that just, especially where that skin bunches up when you smile. So when you smile, you kind of get those wrinkles right in those smile lines there, especially out towards the crow's feet, but often right under the eyelids. It's tempting to think that just by cutting that skin out, that you're going to get rid of those wrinkles. And secondly, it's tempting to think that you can just do that without causing a secondary problem. The issue with the so-called skin pinch, where I have patients that come in and they say, oh, I just had a little skin pinch. Well, the problem with that is that it might look good for a little while where that skin is a little bit tighter, but long term, I've seen people 10, 20 years later, they said, oh yeah, I had a lower eyelid surgery 20 years ago. And you can just see that their eyelashes have rolled downwards and rolled out, and their lower eyelids pulled down to where there's more white showing. It's often not so dramatic like that, but even that subtle amount can just give you kind of a almost bionic eye appearance or a robotic eye. And that's not aesthetically what we're looking for. So you have to be really careful when somebody says, I'm just going to pinch the skin and take some skin out. You want to find a surgeon who's judicious about removing just a tiny little bit if they're going to remove any, or considering other options like a chemical peel or a laser treatment that can tighten the skin without necessarily cutting it out.